So, hello everyone. Welcome to the second part of respiratory system examination. We'll try to cover three or four important topics that are actually topics of anatomy, but they are used in a clinical examination and then can be asked in a medicine viva. So, the first topic is bronchopulmonary segment. So, a bronchopulmonary segment is that part of lung which is supplied by a segmental bronchus. So now what is segmental bronchus? We'll learn it in a little while. So basically bronchopulmonary segment is a part of lung that is supplied by its own segmental bronchus, has its own pulmonary vein and has its own pulmonary artery. Now as far as the bronchial veins are concerned, the bronchial vein they run along the different margins of the bronchopulmonary segment. So imagine this is, so if you look at this diagram, imagine this is one bronchopulmonary segment and this is another bronchopulmonary segment. So the borders of these two where they meet, the bronchial veins they lie over here. So it is of a surgical importance, not of that much importance in your medicine, but the surgeons they do identify the different bronchopulmonary segments based on these veins. Since these veins they are lying on the margins of these two. So what is important as far as our medical medicine is concerned, or the medical part of this bronchopulmonary segment is concerned, that we must know that each lung has about 10 bronchopulmonary segments. So each lung has 10 bronchopulmonary segments. Quite simple. Superior lobe, there will be an apical, then there will be anterior and posterior. Middle lobe, there will be a medial, lateral. Simple. Superiorly, they will apical, anterior, medial lobe. Middle lobe will have lateral and medial. Now, as far as this inferior lobe is concerned, so we have five lobes here, five bronchopulmonary segment. The first is the superior, or we call it as an apical part. So this is a 3D diagram, so it will not be the same diagram that you see inside your anatomy book. So the other lobes will be reflected posteriorly. So what we'll try to do is I'll make an diagram, schematic diagram over this part only. So suppose this is the your lower lobe. So in your lower lobe, the apical part will be known as apical or superior bronchopulmonary segment. Now, after knowing this, there are four other lobes. First is the anterior basal. Then behind this will be obviously posterior basal. Then there is a lateral basal. Behind the lateral basal, there will be medial basal. So to simplify this, I hope you're getting this. The and superior part is an apical, anterior posterior, middle as medial lateral. Inferior has a apical, anterior basal. Behind this is a posterior basal, lateral basal. Behind this is a medial basal. Okay, same thing happens on the left side. The only difference is that we don't have the middle lobe in left lung. So it is anatomically it corresponds to the lingular lobe of the upper lobe. So the medial and lateral part of the middle lobe, we we replace them with something that is known as superior lingular and inferior lingular. So it is quite simple. 10 bronchopulmonary segments on each side. Superior has 3, middle has 2, inferior has 5 on each. The middle lobe is absent on the left side, so it is corresponds to the lingular lobe. So anterior superior lingular, inferior lingular, these correspond to the lateral and medial bronchopulmonary segments of the middle lobe of right side. Okay, so after the concept of bronchopulmonary segment, we'll come to another important concept, that is the how this the airway that we have, that is it starts from the larynx, then it goes down to trachea, then carina, bronchus, mid bronchus, how this area is actually divided. So first of all, we know that this is the trachea, then it bifurcates at the level of angular fluis. Now this part is known as the main bronchus. Now after the main bronchus, there will be the next branch, that is segmental bronchus. Now I have already told you that each bronchopulmonary segment has its own segmental bronchus. So After the first division, the main bronchi are formed, and of the second is segmental bronchi are formed. So the segmental bronchus, it has its own bronchopulmonary segment. So this is important. Now what happens is there is something there we have roughly divided the bronchi into two parts. That is large bronchi, and then there are the small bronchi. So now what is the difference between these two? So difference between these two is that see the tracheal rings or the bronchi, they do contain the cartilage, and as we go from upside down, the amount of cartilage in the trachea and main bronchus and segmental bronchus is more, and as the airway divides and divides, obviously the amount of cartilage it gets thinner and it's replaced by the respiratory tissue where the exchange of gases will occur. So the part, the bronchi which contains more cartilage, more amount of cartilage, we call them as large bronchi. So how much divisions does it take from main bronchus till a large bronchus? That approximately there are the next five generations. That is from the main bronchus, the next five generations till the fifth generation, they'll be called as the large bronchi. Now from the fifth generation of this airway division, from the fifth generation, okay, so from fifth to approximately 15th generation, the bronchi that are present, we'll call them as small bronchi. Okay, so the large bronchi will be the first five generations, and the small bronchi will be fifth to 15th generation, and they'll obviously contain a very little amount of cartilage. Now what happens distal to the 15th generation? That is, by degeneration I mean the 15th division. So as the airway divides, the first division, that is the division of the bronchus into division of trachea into bronchus, is the first generation. So similarly, after the 15th generation, there are uh, there are the branches. We don't call them bronchi anymore. We call them bronchioles. Okay, so they do not contain cartilage at all. Okay, so again, this bronchiole that is formed after the 15th generation or 15th division of trachea, the bronchioles they continue down. Now these bronchioles they continue for another 10 generations. So you see the anatomy of lung, the division of airway is quite a lengthy procedure. Let's see. So in front of the bronchiole, another 10 divisions occurs. That is, we are already 15 divisions. 15 divisions already have occurred before the starting of bronchiole. Now another 10 divisions later, what we get is a distal terminal bronchiole, a distal or terminal bronchiole. Okay, so now this terminal bronchiole, that it contains or it continues as acinus, which continues as respiratory bronchiole, which has this alveolar duct, and ultimately it goes in alveoli. So roughly to revise, we'll start with the trachea, which will divide into main bronchus into segmental bronchus. Now, from first generation to fifth generation, we'll have large bronchi. From the fifth generation onwards till the 15th generation, we'll have small bronchi, which will have cartilage, but it will be of less quantity. Now, from the 15th generation onwards, we'll start to get the airways which lack cartilage. We'll call them as bronchioles. And now these bronchioles, they divide for 10 more generations, and which the 10th generation of the bronchiole we call the distal or terminal bronchiole, which continues as acinus, respiratory bronchiole, alveolar duct, and alveoli. And it is the alveoli where the gaseous exchange occurs. So now what is the importance of this is, you can see that it acts as kind of a filter, that the upper airways they are having a large diameter, and as we go down and down till the alveoli are reached, the diameter it reduces significantly, it reduces massively. So the it forms a kind of filter and obviously acts as a barrier mechanism. So these are the two important concepts, the only important concept that were remaining. So in part 2, we have covered the bronchopulmonary segment, 10 on each sides, and the branching of the airways. So these are the things which are asked in your medicine viva. So, and these are the things which are kind of important, and they do have some clinical relevance. So that is why we have covered this.